Good morning all of you. Myself Yuthika Rao, Assistant Professor, Department of Physiotherapy College, Mahatma Gandhi. So my today's topic, it's very interesting topic. Nowadays females are coming across these conditions, that is physiotherapy in gynecological conditions. Mainly my reference is with pregnancy. So in pregnancy nowadays females are going across lot of problems like I can say low back pain, sciatica, nerve compressions. So today I like to deliver my speech on this topic and I hope it will be helpful to all of you. First is low back pain. So what are the causes of low back pain in pregnancy? It can be physiological, it can be due to joint laxity, anatomical, that can be due to if the lumbar curve is increased, and mechanical if the center of mass is altered. So what is the treatment we'll prefer for this kind of conditions? First of all, posture correction, or will give proper ergonomics to the patient suffering from the low back pain. So proper posture while working, sitting, sleeping, or doing any kind of work. For example, sleeping on a side with a pillow between the knees will take stress of the back. When sitting at a desk, place the rolled up towel behind the back for the support. Rest your feet on the high stepped stool and sit up with shoulders back. Wearing a supporting belt will also help. Now are the exercises. First was the ergonomic approach, so that we can give some our valuable thoughts on the ergonomics so that it can reduce the low back pain while during work. Or in the house also we can give some modifications with the working in the kitchen with the stool, chair, so that the low back pain is decreased. Now comes with the exercises. Regular exercises strengthen the muscles and boost the flexibility that can ease the stress on your spine. So we can recommend back strengthening exercises to these females, like we can go with the Kegel exercises, we can go with the isometrics of back, but with full attention to the condition also. Now lastly, it's heat and cold. Applying heat or cryotherapy to your back will also help with the low back pain. Second is the sacroiliac joint dysfunctions. It is increased weight, it causes due to increased weight during pregnancy. Thrust the sacrum downwards between the ilia in upright postures. In walking, each sacroiliac joint alternately transmits the total loading. Pain may also be referred from the hip and the sacroiliac joint. This is the X-ray showing SI dysfunction. Now third is sciatica. May accompany back pain and sacroiliac joint dysfunction. Increased lordosis would change the lie of the roots. Increased loading may result in spinal foramina being reduced in size with consequent root compression. This is the picture showing in this back muscles, vertebrae nerve and sciatic nerve. It's getting compressed and it will lead to back pain. So here now treatment for the sciatica, positioning strategies, back care and postural correction. So symphysis pubis dysfunction. Width of the symphysis pubis has been shown to increase in pregnancy from about 4 mm to 7 to 9 mm. Pain is decreased as a burning or bruised feeling in and around the joint, which may radiate suprapubically and to medial aspect of the thigh. What is the treatment? First is rest and reduction of non-essential chores, keeping the legs adducted and avoid single leg stance. Pelvic support may reduce pain levels, example thoracentric belt. Gentle isometric contractions of the hip adductors in sitting. Small cushioning between the knees may relieve adductor tension. Now comes the coccydynia. It is also very commonest in all these females. First, what is the treatment you will take to treat with the coccydynia? You can tell them to use cushion while sitting, taking pressure through ischial tuberosity and thighs. Gentle mobilizations will also work. And lastly, ice pack, heat, ultrasound therapy and TENS. This is a picture showing a female is suffering with coccydynia and she is using a tire to come back to the sitting position. Now the thoracic spine pain. Rib cage expands during pregnancy as a result of growing fetus, may have a mechanical effect on the costovertebral joints resulting in pain. Maybe symptoms are radiating to the upper limb. Pain be along the interior margin of the lower ribs, costal margin and intercostal neuralgia. Treatment: first, the mobilization can be done to the costovertebral joints. Posture correction with taping may assist with proprioception. Self-mobilization techniques, exercises and strengthening which may address spasm and stiffness. Rib lifting technique and hot water and ice pack. Some precautions that can be adopted to avoid severe thoracic back pain. Firstly, always stand erect and avoid slouching kind of posture. Long hours of standing can aggravate the back problem. It's better to stretch, to move in between while standing, or you can take rest also if you are standing for long hours. Avoid lifting heavy weights. Sit on a comfortable chair which can provide adequate support to the back. Avoid high heels. Never sleep on your back. Sleep by your sides to give relief to your back. Do not bend your waist. Bend your knees. Now comes the nerve compression syndromes. This is mainly during the third trimester of pregnancy. Fluid retention can lead to edema, visible in ankles, feet, hand and face of the pregnant woman. It can lead to joint mobility and variety of nerve compression syndromes. Then is carpal tunnel syndrome, impairment of sensory and motor nerve functions in the hand caused by compression of median nerve. Hand and wrist pain is common in this. Paresthesia, loss of sensation and pain, difficulty to hold objects and performing fine movements. Treatment: ice pack, rest hand in elevation, wrist and hand exercises. You can suggest ultrasound therapy, splinting to limit that movement, and taking weight to the wrist and arm could be adapted to taking weight through knuckles of the forearm. Brachial plexus pain. Sometimes women also complains of pain and paresthesia in the shoulder and arm. Fluid retention and postural changes are the cause to this kind of condition. Treatment: again, the exercises of the shoulder girdle, we can go with the strengthening protocol of shoulder, then stretching exercises, and elevation of arm is the rest protocol. Myalgia parasitica. Generalized fluid retention results in compression of femoral cutaneous nerve of the thigh as it passes under the inguinal ligament. Symptoms can be there can be burning, paresthesia over the anterolateral aspect of the thigh, and mild sensory loss to light and pinprick. And treatment can be TENS, transcutaneous electrolytic nerve stimulation. Here is a picture. Nerve compression is shown in the lateral femoral cutaneous nerve is getting compressed over there. So because of this, there can be paresthesia, burning sensation. Now posterior tibial nerve compression. Ankle edema can compress the posterior tibial nerve. Ankle edema can be there because of the overweight in the pregnancy. As it passes behind the medial malleolus, this will also lead to again paresthesia of the sole of the foot and plantar aspect of the toes. Treatment: resting with the legs in elevation, foot and ankle exercises, ice packs and ultrasound. Thank you.